Okay, so today we are going to see a case of Dequeveins Tenosynovitis. Okay, so this is your patient. So you need to do the examination of the patient having Dequeveins Tenosynovitis. So what is Teno?
Inflammation.
Teno means what? Tendon. Then what is synovitis? Inflammation of synovial sheath. Okay, so the synovial layer of your tendon sheath will be getting inflamed. Okay, so in Dequeveins Tenosynovitis, which is the two muscle is getting inflamed?
Abductor pollicis longus, extensor pollicis.
Okay, so there are two muscles, that is, if you see the hand, here you have the abductor pollicis longus, that is doing the abduction, and you have the extensor pollicis brevis. Okay, that will do the extension of your thumb. Okay, so if the tendon sheath of these two muscles is getting inflamed, we will call this as Dequeveins Tenosynovitis. Okay, so this is a patient. He has played football, and after that, the football has hit over this area, and he has got inflammation over this area. Okay, now you need to diagnose this patient is having Dequeveins. So what are the examination you can do? First, someone come and do the clinical features. What will be the clinical features you can examine in this patient? So, when someone come and do. So, what will be the most common clinical feature the patient will be presenting?
Pain and tenderness and radial process.
Okay, so the patient will be having pain over the radial styloid process, and there will be tenderness. Okay. While you touch the patient, he will be withdrawing the hand. Okay, so that is meant by tenderness. So after that symptom, how you will interpret this is Dequeveins Tenosynovitis? You need to have a special test with you. Okay, so what special test you need to do for confirming this is Dequeveins? Frankenstein test. Okay, someone come and do the Frankenstein test for the patient. So before you are performing the Frankenstein test, you need to ask all the history, and you need to confirm what are the contraindications if the patient is having contraindication and all. Then you need to do the special test. So this is how you diagnose whether this is the patient is having Frankenstein, whether the patient is having Dequeveins Tenosynovitis. Ask the patient to pronate, then adduct the thumb, then you need to make the full fist, then you need to radially deviate. If the patient is having pain over this region, you can tell that the patient is having Dequeveins Tenosynovitis. After that, what all the treatment you can give for the patient? So the basic treatment, what you can give?
Medication.
Pain medication and
Non-steroidal
non-steroidal anti-inflammatory drugs. So what is the NSAID you can give for the patient? Ibuprofen. Okay. So after pain medications and analgesics, what physiotherapy treatment you can prescribe? Ultrasound to relieve the pain and to promote tendon healing. Okay. So if the patient is having a chronic case, what treatment you can provide? You can remove the tendon sheath. Otherwise,
injection.
you can provide injection. Which injection you need to provide? Hydrocortisone. You can inject this tendon sheath. You can provide hydrocortisone injection. And if the patient is relieving the symptoms, you can go with that treatment. Okay. So this is all about Dequeveins Tenosynovitis examination and treatment. Hope you all understood.
Yes, ma'am.
Thank you.
Thank you.